We should be live. I would love to just get a confirmation that we are.
It says on air.
Not yet.
Not yet. It says on air.
All right. We'll get started. This will probably load right after. So thank you everyone who is joining to listen today. We're very, very excited to have you here. I'm Yves Maman. I'm one of the co-founders at Agave Health. If you're here, you probably know what we do. But in a short sentence, we support adults with ADHD in general and also in the workforce. And I am joined today by two outstanding speakers. First of all, Rebecca Warnken, who joins us from Aon, where really day in, day out, she works with employers on inclusive benefits, on health equity, and on social determinants of health strategies so that they can address the needs of their workforce. And we are joined as well by Catherine Verbeek, who is from Crete United, where she is the Senior Director of Total Rewards, leading the health benefits strategy for employees there and coming with over 30 years of experience in the field. So we have truly two leading professionals in this field who deeply care and deeply understand the intricacies of neurodiversity care. So I'm very excited to be joined by the both of you today. And truly what we're going to basically talk about today is definitely not about awareness for neurodiversity, because neurodiversity has taken center stage. It's funny, only 3 years ago, we still all felt that there was some education to be made in this space, and now it's not the case anymore at all. It has definitely taken center stage. The prevalence is obviously very high. Nobody questions anymore the impact of neurodiversity and ADHD or autism in adulthood. And now really the question that is left on the table is, how should neurodiversity care be actually designed so that it works, so that it drives meaningful outcomes for everybody involved? And this is what we're going to deep dive into in this chat today. And to do so, I'd like to start with the employer reality. So benefits leaders are approached with solutions about everything touching healthcare. In parallel, budgets are often limited, healthcare costs keep climbing, and prioritizations basically must be made. Now, in this context, when employers decide to prioritize neurodiversity, the first question I'd like to ask you both is, what happens next? And I'd love to start with you, Kate, as someone who made that prioritization decision at an employer. So when you make that decision, what happens next?
So there's a couple pieces. It's one, identifying that there's a need, and then it's putting the priority to put a solve or a help in place. And once we did that, and once we've done that, then it's how do you make sure that one, everybody is learning about it and everybody has access to it. So I think the communication piece is a big part of it. And it's also, I know, Eve, to your point, the awareness is out there, but it's also, since we brought Agave on, a lot of our employees became more aware. So we introduced it as a benefit, and it started having people ask questions about, is this something that might be good for me or my family? We have these symptoms, we have this, we notice this going on. So I think it's still an awareness that comes as we launch the benefit, but bringing it on, it's the communication piece, which creates the different levels to it in terms of what happens next. And from that, it's really quite surprising to see. I was surprised to see how many of our employees engaged quickly. We didn't expect to have as many engage as quickly. And then the feedback we received after the first 3 months was just phenomenal. Like, I didn't realize I could have this much improvement, or my spouse is doing so much better because of this. And then that trickles down to a variety of, then different things, like how do we get this out there even more, and how do we really make sure we're touching the right people? So it comes in different layers, but I think that once it's brought on, the communication piece and making sure the awareness is out there and how to get it utilized is really key.
Super interesting. Rebecca, so you have a sort of wider view because you speak to a whole bunch of different employers who have really, different industries and different backgrounds. So what do you see? And specifically, I'm interested to hear from you, where do intentions meet constraints when it comes to deciding to prioritize
Right.
neurodiversity?
And I completely agree with Kate. I think, yes, neurodiversity has become more of a household term, but still there's a lot of work around what does that actually mean and who do we include in that? And, from the perspective of parents and caregivers or neurodivergent people in the workplace themselves, or, people who are managing or leading teams that have neurodivergent people, I fit in all three of those buckets. So I think it's really, important to kind of define who we're talking about. And then for employers to Kate's point, identify what we're trying to solve. I think this can be really overwhelming when we look at it from that lens of like, this is actually a lot of people across our workforce that we're talking about. And unlike other focus areas like cancer or diabetes that really are limited in this sort of medical model construct, we're not just talking about healthcare, we're talking about experience navigating work, navigating life. So it just becomes a much bigger need. And I think that can feel overwhelming for a lot of employers. So it's really important to take that step back and think like, what is it we're trying to solve? Who are we trying to impact and how? So we can't just throw something in there and just kind of hope it will work. We have to be very intentional about what's the impact that, we're trying to have for our people.
That's interesting as you're saying that, because the neurodiverse population, as you were saying, it can be in different buckets, right? It can be, I have neurodiversity, or I'm caring for someone who has a neurodiversity, or I'm in a household with, my partner has this or whatever. And so it's very hard to identify like, okay, this is the X amount of employees that I have that fit in that bucket. And so considering this complexity, what do you see, Rebecca, that employers who do take this step who do decide, okay, I'm going to prioritize neurodiversity, what are they saying that they're trying to solve for? What is the X that they are identifying?
Great question. And that sort of speaks to some of the constraints too, because I think a lot of the budgetary constraints and just the time and bandwidth are playing into this. So, how do we, enhance not just the medical claims bucket that I might be responsible for, but how do we have a positive impact on the experience of somebody, coming to work every day, managing things outside of work, that all really contribute to how, productive and engaged and how well I feel, coming to work every day. And those are harder things to measure, of course. So, I think that's where it's a sort of a mix of that like quantitative and qualitative, viewpoint where, yes, there's some measures that we can look at, like turnover rates for, people who identify as neurodiverse, or, people who are part of BRGs that might, share an interest of being parents and carers, looking at productivity. And we can also, though, look at, survey data and asking people, how do you feel about your experience working here? And is it improved since we've taken steps to implement programs and supports to help you? So I think it's sort of we need to do both of those things. That answers your question.
Yeah, no, definitely. Kate, it seems like you wanted to add stuff on top of that.
Yeah, I would also, to Rebecca's point, it's the employee. It's who's at home that's impacted by this, because a lot of times, especially in, seeing it in the manufacturing world, or, jobs that require somebody be on site to do something, sometimes it's not the employee, it's the family member at home, but the employee is the caregiver. And it's what's weighing the employee down, and being able to not have it be a stigma, right? And be able to have communication about it, and then be able to offer benefits that provide support to the employee, but also to their family member at home. I think that's actually, where it all falls into as part of the employer and our responsibility. If we're going to offer benefits, and we're going to, you're a resource. Our employees are our resources. They're why we're all here. We need to make it so that when they leave the house, and whoever is home is also able to care for themselves, and they're not focused on how is that person doing, whether it's their, we're always focused on it, but it's one less thing that they're trying to balance while they're trying to do their work. So it is a budgetary constraint, but it also becomes the flip side of that, where it's costing us as employers a lot of money to not address it, and to not speak about it, and to not highlight that this is just as important as other conditions, and this is why we focus on it.
Right. There's increasing. I mean, this is such an studied area, but there is research to point to more time out of work, taking leaves of absence, dropping out of the workforce completely because of juggling the care for a loved one. And then we also see for employees themselves, much higher unemployment rates, or not being in the right job for the right skill set. That is just so much more common when we're talking about people with hidden disabilities and neurodiversity. So we at least have a lot of those indicators to tell us maybe we could be doing better.
And I would just add one more thing, Eve, too, which is the medications, right? I mean, a lot of it, people just jump to, oh, I have this condition, I want to take this pill and have it go away. There are medications out there, but neurodiversity is definitely one that when you study and learn about it, it's a behavioral change for all of us even, right? And I think that's where part of it comes into. There needs to be some level of patience and understanding that medication doesn't solve everything. In all cases, it may help, but also medication has side effects that may impede people to do their jobs or even get to their jobs. So it's finding that balance of what works and being able to support that where an employee feels safe in knowing that they can explore their options while they go through their journey.
Fascinating. So it's interesting because what we're saying overall is really identifying the problem that we're trying to solve by introducing a neurodiversity focused benefit is not easy or or upfront, because it has all of these different layers. It's the people who have neurodiversity themselves, and it's the people who care for people who do, and it's the people who have it and also have it diagnosed, and the people who have it but is not diagnosed, right?
Mm-hmm.
And those who get the medication, those who don't. So there's a lot of sort of moving parts there. So definitely identifying what the problem that we're trying to solve is a huge challenge.
Mm-hmm.
But at the same time, I think, and correct me if I'm wrong, but what I take from what you both are saying is really this challenge is maybe hard to identify, but it's definitely there, and you want to be aware of it and to do something about it, because when it's not looked at, the cost actually piles up.
Yeah.
You guys align with that?
A stat I like to point out is I think on average 3% of employees disclose a disability in the workplace, but we know that, whatever stat you pick, 1 in 6, 1 in 5 people are neurodivergent. So clearly there's a really big mismatch there in terms of people's comfort level, even coming forth and disclosing a disability in the workplace for fear of stigma, for fear of, I'm going to be treated differently, for all those reasons. So that I think that white space really speaks to there's a lot of people under the surface that we just don't even know are out there that really need and could benefit from help.
And I think too, on top of that, Rebecca, is that I think it's seen as almost black and white. I either have something so bad it needs intervention, or it's not that bad and I'll just have to deal with it and get by and struggle. And there's a huge gray area there that people fall in. Most of us fall in. And I think that gets missed too when it's looking just for the solve of X.
If I can go on like a tiny tangent, I think what's fascinating too is the connection of this topic with women's health, and fluctuating hormone levels and different life stages can have a significant impact on your cognitive functioning and executive functioning as well. And so, often women go undiagnosed in childhood and are diagnosed later in life. Perimenopause, menopause hit, and that's when maybe more support is needed. So I completely agree. This isn't a black and white, it's fluid. And, at the end of the day, when we put in supports for people who are neurodivergent, it really benefits everybody, because we all have days where maybe our cognitive functioning is a little bit compromised. And not to say like everyone is ADHD or everyone's neurodivergent, but I just think that mentality of just, being a little bit more flexible, that, our brain capacity is going to be fluid and fluctuating.
So that's actually a great segue, to talk about, as you raise this sort of fluidity about our executive functioning in general, and let alone if we have a neurodiversity, into the sort of zoom out as to, okay, let's say that, an employer in question has identified or feels comfortable identifying the X that they're trying to solve. Then how do they actually measure outcomes? And I think that this is one of the huge pieces, right? What we hear is like the standards in the mental health industry, generally speaking, so not just relating to neurodiversity, it is really to look at, employee satisfaction for a given benefit, to look at actual engagement and enrollment into it, to see that there is interest, and to look at ROI, right? But all of these measures are not built for a specialized care sort of approach. Interestingly, we managed to fit ourselves into that box, right? We did all the different analyses and we managed to like show those results. But I am wondering, beyond that, like how do you actually measure the outcome when it comes to neurodiversity, given the complexity of identifying the problem you're solving for in the first place?
Personally, I think a lot of it comes down to honest communication with employees. And I think there's a part of that too, that while me specifically, I'm in benefits and I'm part of HR, I am separate from HR. And I found that employees feel more comfortable talking to me than they would necessarily someone who they may report to about how they're doing. So I think having a communication that people can trust and don't feel judged upon is important. And I think that's different in all organizations, but I also think it's the same in all organizations. And then the other piece to that in that communication is if it was for the employee themselves or the family member at home, how are they feeling, and get an honest, contribution from them, a statement from them, and understand how they're feeling. Do they feel better? And then also, is this a person who we identified and maybe they reached out or we reached out to them because they were late to work all of the time or they were calling out all of the time? And are we seeing the ROI on actual things that we can measure at work? But it is definitely not one of those where you can take a blood test and go, yep, you're better. And exactly. I think to Rebecca's point too, it fluctuates. And some people may be on their journey and doing well and hit a plateau. And then how did we help them? And did this help them? And those skills that they acquired, did they feel prepared for the next, whatever the next is? But I think the journey is a lot about communication and trust between all different avenues. And I also think there's a trust that falls in families too. It's hard to even acknowledge for some families to say, my child suffers from, or I suffer from, and I feel like I'm not giving my whole to the family. And being able to have those discussions so that family members can talk amongst themselves and actually provide each other with that honest feedback to say, Mom, I think you're doing better, or I didn't know you were struggling with this, or and some people don't even know that what they're struggling with till it's identified. So I think that's a long-winded answer to it's a very complex step after that to learn how the return is or what the return is.
Well said, Kate. And if I could just pile on a little bit, I think we need to be cautious too about engagement surveys, even though I mentioned them myself earlier, because I think people don't know what they don't know. I mean, lots of people are kind of just chugging along in life. Maybe they know they have a diagnosis, maybe they don't, and just kind of accepting the environment around them as what it is versus, hey, we're actually talking about this more and we want to change the workplace to be more accommodating and flexible of all kinds of different needs. So I think the phrasing of questions, the language we use is really important, and it does connect so closely to inclusion and belonging. And how does work make me feel? How does my manager make me feel? Do I feel like I belong here in the workplace? Psychological safety. I think those pieces are all really important. And I also would say, aspirationally, I do, you mentioned mental health, Eve. I do think there is such a overlap in mental health and neurodiversity. You can have a diagnosis in one box and not the other, and vice versa, but there's, they're very interrelated. So I would love to see more research and employers willing to look at their data in a way that we can see measurable impact in our mental health spend and other health conditions for our, isolating our neurodivergent populations. I suspect, and again, there just hasn't been enough research that by better supporting the care for this population, we'll be seeing improvements in those other areas as well. It's harder to measure because, again, most people need to self-identify to be, flagged in any kind of claim file, and that's, a topic for another day. But I think that the possibility is there.
I think it's fascinating what you're saying, because we're actually spoiler alert, we're going to very soon in the coming weeks publish our very first claims data analysis with a client of ours. And one of the things that we have found, which was fascinating, was that for people who came in, so as but maybe for our audience, Agave Health today is really focused on ADHD specifically within the neurodiversity umbrella. Neurodiversity is obviously wider than this. And what we saw was that for the people who come in without an ADHD diagnosis before they come in, we see a tremendous, I'm going to leave the number out so that you all read the study when it comes out, but this decrease in specifically behavioral health claims before and after joining Agave. So basically, we understand that they were looking for support, but that support was too generic and it didn't really help. But once they got the support that was specialized, then suddenly the claims sort of, they go down in the behavioral health claims, and the usage of Agave sort of goes up. So I definitely agree that, like, it's interesting. You really need to, like, there isn't a lot of research yet there, but we at least on our end see the signs of what you're expecting to see. So
and we are working with employers to really kind of separate the clinical from the subclinical. Like when coaching is the more appropriate avenue for someone who doesn't need a licensed therapist. I think that distinction is becoming more clear and prevalent in our design of benefits.
Definitely. So if you were advising an employer who's considering a neurodiversity, like, supporting somehow their employees with neurodiversity, how would you recommend them to define success?
Well, and I think this is the same for really any benefit. I think we all are struggling with engagement and making sure people know about the benefits that we offer. So I think seeing, first of all, and the participation in the program is a good signal that people want it and know it's there. And then I think, using some of those, excuse me, my voice maybe isn't 100% back. Some of those more qualitative measures that we talked about, embedding that into the benefits experience. How did that help you? How much are you seeing improvements in your ability to focus at work? And some of those, important measures that we're looking to solve for, I think, in the moment. And I think another piece is just, again, how we kind of put this all together, because maybe what you need isn't that exact neurodiversity solution, but it's awareness or help getting to maybe a provider in a different discipline that knows and understands neurodiversity. So being able to kind of leverage those connection points across the benefits experience in a way that works for the member.
Definitely. Kate, what would you recommend as someone who did it?
So there's a couple things to it. I think, a lot of it goes back to communication, in terms of the communication back from people. But in actually, some of it is the less noise, is quieter, is the employee isn't standing out anymore for certain things. We're not hearing, when there's a problem, people are vocal. When things are working, people don't necessarily vocalize till they feel really comfortable and vocalize that I'm very happy with this. We saw a lot of that and like I said, we were surprised at how quickly we saw that. So I think there's ways that you need to look at it that aren't necessarily the same as maybe some other benefits, because it can be sensitive, and it is still, people are very aware, and people want some privacy sometimes and space around it. So that's what I mean by not having noise around it. I also think in the case of some employers, depending on your benefit structure, who's handling communications. Do you have a call center? Are they highlighting that, hey, don't forget when someone calls about something, don't forget your company also, or our company offers this benefit, this solution. That might be something you want to reach out about, just because they overlap, or if, people have questions about it, it can't hurt to have advocates that speak to what the benefits are when there are questions from employees, because not everything is one and done, right? It's not, this is what's wrong with me, I just need this solution and that's it. So I think there's several different layers that go on that. And then being part of the benefits team, just again, being open to communications and making sure that there's refreshes out there that we say, don't forget you have this benefit, but also asking if you have feedback on benefits, all benefits, we'd love to know. And just keeping that door open so that people feel comfortable with the feedback the other way.
So joining that, we actually have a question in the chat. Somebody asked, how are employees educated on neurodiversity? Generally speaking, I think besides, outside of like having a specific benefit for it. Kate, is there anything that you have been you and your teams have been doing in order to just educate about the existence of this or the recognition of it?
Yep. So I think one of the things we did was we started with the questions around what might be ADHD, what might be a neurodiversity. Do you struggle with whatever, A, B, C, D? And we put that out there as part of a communication, so that we could highlight what the benefit was, but also so that we got people thinking about it. So there was an awareness to it, because people may not know, to the question, what is this? Well, if you struggle or suffer from these things, you may, I'm not saying you do, but you may benefit from this benefit we have, or learning more about neurodiversity. And we did a lot of that communication for our employees, so that they could be aware of, oh, maybe this is something I need to talk to my son about, or my daughter about, or myself, and look at and understand, and kind of not explain, but ask the questions that might, when they find the answers for themselves, may lead to that is something that they may benefit from, if that makes sense.
Rebecca, is this what you
Maybe I
see?
can add, and I can say this both as an employee of Aon and some of the things we're doing, but I think really helping managers and leaders too. We can't just keep throwing trainings at managers, like, to make that clear, but I think just weaving in just some of the terminology and understanding of what neurodiversity is and how that might impact someone's work experience, just weaving that into, training and support that's available to managers, and having a place to go. Like, I think that's one, great part too about this neurodiversity care space, is it's also helping those managers and leaders who are like, hey, I have someone on my team with ADHD. I'm just not really sure how to help them. Like, I want to. And I think there's good intentions all around, but I think a lot of people get nervous or aren't sure what to do. So just putting the information out there in a way that people can, tap into it when they need it is important. I think just as the term is becoming more prevalent, that is great, but it's, how do I make this bite-sized in a way that I can now take it and, it just becomes part of the fabric of everything we do.
Super interesting. So we have another few minutes, and I want to make sure that another 15 minutes or so, and I want to make sure that we address one of the elephants that happens to be in every room lately, and actually discuss it wide open to see what we get to. So obviously, AI is stepping in, right?
Oh, the AI term. There we are.
There we are. So now, I sit on the side of the solutions creation, right? Mm-hmm. And so there, obviously, we always think about it. Like, okay, where does it sit? How do we use it? Do we use it at all? Do we not use it at all? Do we use it only sort of on the back end to help our providers, or do we also bring it in front of the member or the employee that we're essentially supporting, things like that? At Agave, we decided to take a very strong stance about this. We have an artificial intelligence policy that's available on our website. I recently wrote an opinion piece about what we think the right boundaries are, and the boundaries that we have chosen to sort of stand by. But I would love to hear from each of you your opinion on this. Like, okay, and this is not necessarily just about neurodiversity benefits, but even just more broadly about mental health care, right? Mental health benefits. How do you feel about, those discussions around, well, maybe we'll just give an AI therapist to everyone and stuff like that? Like, where do you sit, and what do you see other employers say as well?
I'm happy to go first. I think, because we talk about this a lot, as you can imagine, I think, we need to proceed cautiously, but I'm actually really excited about the potential of AI to specifically support neurodiversity but lots of segments of our population, because we keep talking about the need for personalization. And that is just a constant challenge for employers, is navigating to the right care. How do we get the right information to the right people? And just, there's always been budget, resource, administrative constraints around that. AI is really providing a solve for a lot of that. How do we get that, really, I'm a neurodivergent person who's entering menopause, who's also a childcare provider, all that, those pieces of our identity. So it's less about a program for women or a program for neurodiversity. It's just, here's the thing I need to be successful based on, these, millions of learnings of, people who are just like me. So I'm excited about AI. I think, though, we really need to make sure we're understanding, where is the line between, using AI to help navigate or, provide maybe the next best action versus actually providing medical care or, advising people or delivering therapy. I think that's where there's still, a bit of caution. I almost think too about how the pandemic, inadvertently or accidentally, really benefited neurodivergent people because suddenly they were able to work from home, which might have been, actually a much more comfortable working environment. I think AI also kind of does some of that too, where I think, not to stereotype, but I think a lot of neurodivergent people are, nervous for, asking for help, or, don't like to pick up the phone to call, when they need something. That's me. I will engage with a robot all day if it means I can avoid talking to a person. I think there's a lot of people out there like that. So again, not to stereotype, but I do think it plays into maybe we all have different ways of engaging and communicating and seeking out information. And that's just now another tool in our toolkit.
And I would just also, Rebecca, I agree. I think it's a fine line too. I think the need for personal care and personal interaction and, communication with actually another person is critical, especially when you're looking at neurodivergent care. It's AI, so it's not there to, it isn't a person. It's AI, and it's built off of other things that other people, fed with it and how it learned. And I don't know, I'm no AI expert, but I think it's good to a point, but I think it's also detrimental to a point. And I think if it's just the thing people are counting on, I'm concerned for those people, because I think they'll miss out and may do more harm and hinder than help. So
yeah. When we're evaluating AI solutions, it's sort of like, where's the human that's still here? Like, where's the human oversight, the human intervention? Maybe we can solve 80% of our call-ins or needs with the AI chatbot, but then we also need to direct people to a human for, some situations too.
So Kate, when you're approached by solutions, not even necessarily in our space, but generally speaking, who talk a lot about their leverage of AI, is this something that you look for? Like, you actually ask, well, where's the human? Like, I want to make sure somebody.
I mean, I think it's really important that it is a human, depending on the interaction, right? I mean, use the AI to help me make a benefit choice or do certain things. There's still a human interaction needed. Do data analytics on it and certain things to help me even identify who I should be reaching out to for certain things. That's great. But I use it enough to say I'm cautiously optimistic about it. I found mistakes in things. I found things where I'm nervous about it. So I think just like everything else, it needs to be taken with a question. But I think the same is true of, when you're talking to somebody, and whether it's neurodivergent care or mental behavioral health therapy, if you're not comfortable with the person you're talking with, or you don't like, you don't feel good about what they're saying, question it, and the same holds true whether it's AI or a person. I think people should always question when they're feeling like that. I think there's a sense of false security with AI, like, oh, it's all protected and no one knows and I can be anonymous. And actually quite the opposite is true. I'm not saying we're all going to learn about each other's conditions through, using AI, but I think there's a lot of things out there that it could be more detrimental if not in the right hands or used in the right practice.
Right.
That's what you hear as well, Rebecca? Like,
I think there's
where's the responsible
a lot of appropriate caution, I think, and being really thoughtful and deliberate about what we can rely on AI for and what we should still, we still want our doctors and we still want people to have a relationship with their managers. And I think just having it really just requires that deliberate thought around where are people getting their information? Because there is a lot of misinformation out there, especially in the neurodiversity space. I just heard a stat that 50% of what's out there on TikTok is incorrect around neurodiversity. So it's that's where people are going, though. People are going, we see people are going to ChatGPT for health information. They're going to TikTok. So as an employer, I think it's the floodgates are open. How do we rein it in so that we're giving people the right care and advice?
Yeah.
Definitely. To be honest, it's interesting because obviously, we've had endless amounts of conversations around this from, a product and engineering standpoint, where we're super excited about the capabilities of AI and all of the things that we can get. And on the sort of the clinical care piece of our company, that is obviously, more, I don't want to say concerned, I want to say cautious of, making sure that if we do use AI, let's make sure the right guardrails are in place, they're solid enough to be respected by the model, etc. And it's definitely, I tend to agree that it's a fine line. and yet it's we have to build with this new reality in mind, because it can make us help more people more efficiently. But again, as you say, like making sure that the right guardrails are in place, that the human intervention is always there, and that the person who's guiding really the other person has been trained to do so. So unlike the AI.
The earliest adopters have been providers themselves. It just makes their jobs easier with, note taking and, organizing. I think so. There's like, it's not black and white. There's the good, but there's also the proceed with caution.
For sure. So it's a good segue to move to the last part of our discussion today, which is a lightning round.
Ooh.
So think fast. I'll start with a sentence, and then one of you completes it, the other one goes after, and then we continue with the next one. And the first one will actually be really related to everything you just said now, Rebecca, about the fact that 50% of everything that is said about neurodiversity on TikTok is actually false. So, in this spirit, the biggest myth about neurodiversity benefits is
you need a medication.
That's niche. I'm really glad the word niche didn't come up at all in our conversation today. It's not a niche benefit. This is a benefit that will help everybody.
Okay, Kate, you would agree to that, or you would answer it differently?
No, I agree. I also think people just think it's a condition that you can solve with a medicine, and it's not.
Interesting. All right, the next one, Kate, you start. Missing the point. You're missing the point if you are not measuring, or if you are measuring.
For neurodiversity, oh God, I'm stumped by the question. You're missing the point if you don't think neurodiversity impacts pretty much every person in some way, whether it's themselves directly or family members, and that there is probably help that's needed for people.
Amazing. Great. Rebecca, would you answer that differently?
Ooh. Yeah, I think if you're missing the point if you're viewing this as a point solution, or just a clinical care solution, because it is, as we've talked about today, so much more than that.
Amazing. A neurodiversity benefit fails when it is treated like.
Am I first?
Yeah.
What haven't I said yet? If we don't include neurodivergent people in the conversation, I think that's maybe my answer to that one.
Nice.
I would say it fails when it's treated like every other condition and not seen for something that it is, which is not a niche, but its own separate category.
Amazing. One question that benefits leaders should ask when neurodiversity benefits.
When they're what? Sorry.
One question that benefits leaders should ask when it comes to neurodiversity benefits, or to
can we afford not to do it?
Ooh, very good.
I'm going to take a different approach. Who else are my champions at the organization? It shouldn't have to be just the benefits leader carrying the torch. There's other HR partners and BRG leaders and just passionate people that partnering together and being on the same team.
Amazing. In 3 years, when neurodiversity benefits will be adopted by everybody pretty much, we will realize that.
Maybe this isn't such a mysterious benefit area, and we don't even need a special category for it, because it's just woven into the fabric of what we do for all of our people in delivering care.
Interesting. Okay.
I'm going to say in 3 years, I'd like to say we will realize that everybody could probably benefit from some sort of knowledge and care in the neurodivergent space. But I think 3 years is too soon, unfortunately.
You don't have faith in our space to.
We have seen a lot change in just the last 3 years. So
That's true. We have. I mean, things work slowly too, right? I mean, and things happen and life happens, and I don't know. No one expected a pandemic in 2020, so
That is very valid.
I approach with a little bit of caution and optimism.
Yeah.
So maybe 5 years, I'll say.
All right, we'll settle on 5 years. Sounds good. And the last one, you have in your career, because you haven't. I mean, Kate, obviously, you don't only deal with neurodiversity; you deal with all of the health benefits of the populations that you support. And Rebecca, you haven't always been focused on neurodiversity and inclusion and stuff like that. So, ever since you have started to look into this space, respectively, you have changed your mind about.
I think, again, I can be vulnerable. I think when I started down this path, I thought it was about creating programs for people who are neurodivergent without really thinking about, like, this should be across organizations. We can't just hire people into roles and, keep this in the self-contained bucket, realizing how neurodiversity really, is across, entire workforces. And, that's the lens with which we should think about it, is sort of how do we do this so that it works for everybody?
Interesting. Kate, what did you change your mind about?
How hard it would be to get people engaged. I thought it would be, I got to be honest, when we first started, I thought it would be harder to get people engaged. And as I said from the beginning, we were surprised, pleasantly surprised by the amount of engagement we had and positive results we had. And I would say that's probably one of my biggest takeaways on that.
And I would say, like, just the biggest joy for me is, like, to Kate's point, I didn't know what this topic was going to bring. I was just like, I think this is a thing. But just how many people have positively responded and identified and shared their stories, I think that's so powerful. It's just we're all, more aware and vulnerable about talking about neurodiversity.
Definitely. Well, definitely, I agree. This was fascinating, and I honestly, I guess, just like you both, I also listen to a whole bunch of webinars in the space and stuff, and I feel like very often we talk about, sort of, I mean, what is being talked about is sort of what everybody talks about, like, okay, so how do you move from ideation to implementation and all of these things and the technicalities of it. And sometimes it's really important and helpful. And this is what we're trying to do with these webinars that we're doing with Agave and that we'll continue to do throughout this year, is to have really candid conversations with the people who make those decisions or who influence those decisions, but about sort of, the real stuff, the stuff that goes under it. Like, okay, so yes, we can talk about how to implement Agave or another neurodiversity benefit, or we can talk about how hard it is to actually say, well, as a benefits leader, this is the amount of people I think this is going to impact, right? Which is one of the questions that we addressed together today. So I'd like to really thank you for taking a sort of this different approach with us today, and to have this really candid and thoughtful conversation with me. I think it was very valuable. I saw the chat was super active, so we'll definitely catch up on that. And I'd like, I think that the main takeaways here from everything that we discussed is that in the end of the day, to drive meaningful outcomes, design is key, which includes identifying the problem that you're solving for. Aligning the expectations is indispensable, right? With, okay, so how sort of, how am I going to measure this? How am I going to go broad enough to measure this? Because my expectation is not necessarily, I shouldn't expect to see necessarily everything very clear in a nice little box on my claims data, right?
Yeah.
It's not going to appear this way. And it's truly that measuring for what truly drives patient outcomes is the core of the challenge, right? Think about the caregivers, think about those who experience the challenges, not just at work, but also in their personal life, which in turn affects them at work. So again, thank you so much to both of you. And thank you for all of you for joining and listening. Feel free to continue the conversation in the comment section. We'll definitely be there to continue it. And and until next time.
Thank you.